I'm also pleased to be joined by our Deputy Director of our team, Shireen Mathrani, who will help talk through some of our presentation today. And we're just going to give an introduction to the team, which Shireen will do, and look at the resources that we have available for you, and look at any of the new resources that were coming out. And we've got Hywell in the team to come up again and talk about the new cost effectiveness tool, which I think will be really useful to all of you. Being a data analyst, as you know, where I introduced myself this morning, I'm a big fan of collecting information and data. So I've popped another questionnaire on your tables. It's really important for us to get feedback from you on our resources. So that, the list that we're talking about today will talk you through that. And if you don't mind taking some time just to comment to help us improve our offer to you.
Hi everyone, my name's Shireen Mathrani and I'm Deputy Director of the Obesity Knowledge and Intelligence team with my fellow Deputy Director, Di Swanston, who can be here today. A lot of you may know us from the past as National Obesity Observatory, but we're now well integrated into the structure of Publich Health England as one of the knowledge and intelligence teams. So as it says there, we provide a single point of contact for wide-ranging authoritative information, and that's on data and data analysis and tools and public health evaluation, which is extremely important, and we'd really like to see people evaluating all the good work they do to a consistent standard framework, which Caroline will mention as we go along. And evidence-based papers and research as well. Within our team, within Obesity K&I, we have access to, and we have inbuilt to our team, we have academics on secondment to us, and we also have international experts. So I want to assure you that you'll get the best up-to-date information that you can at the time. So, on our website, in case if you are familiar with it, just bear with me, but if you're not, we have a whole section on about obesity, and on the left hand, you can see all the different topics that we cover, from adult and child obesity to different measurement methods, and various key target groups, such as maternal obesity, morbid obesity. We talk about health inequalities, the economics of obesity, and so on. So we also do a range of different briefing papers that are up to date, that are peer-reviewed, academically reviewed, and Caroline will go on to that, but there was just one I wanted to mention called Social and Economic Inequalities in Diet and Physical Activity. So for those of you that haven't seen it, it provides we all know that people who are in deprived situations are probably less likely to be able to have a lot of access to good physical activity and to a healthy diet. But this provides you locally with all the evidence you might need if you need to make that case, in your JSNAs or to your health and well-being boards. And this area of the website, I think, will hopefully, or is hopefully, useful to you, because we've updated it recently, and we're making the case in tackling obesity across the local authority for every single department of the local authority to see, why is it important to a transport department? What can they do about it? How does it actually save economic, it's actually cost effective to tackle obesity? What about the planning department, the environmental areas? What about transport? What about parks and green spaces? It's not just about leisure, and it's not just about health. It's all those other aspects, which obviously now people are in the local authority, they have more access to those areas. I'm going to hand over back to Caroline.
Okay, I've heard the word evaluation quite a lot today, which is fantastic. And I'm not sure if you could wave at me if you have used or heard of or used of these standard evaluation frameworks. Yay, that's brilliant. So we produced the first one, the weight management intervention, standard evaluation framework. And all these documents kind of summarise why we should evaluate, and they help you sort of understand evaluation and why we should do it. And they also suggest a core criteria for data collection within each one. So the newer ones, which are the larger images on the screen, are for physical activity interventions and dietary interventions, and they're relatively sort of recent publications. And I think it's great that you guys are using these, and we can sort of produce and collect a standard set of evaluation data which we can share with each other to learn what works and possibly more importantly learn what doesn't work, and share that and just sort of try and sort of really increase the evidence base for sort of weight management interventions. Before I forget, I forgot this last week, we do training events on these as well, so they're not sort of really regular, but you can find information on our website about how you can access training for evaluation in public health. And Shireen has already mentioned one of our latest briefing papers, the Diet and Physical Activity Inequalities paper, but we also have many other briefing papers on the website. One of the other more recent ones was Obesity and Disability in Adults. That's available on our website, and the Obesity and Disability in Children will be coming soon. These briefing papers kind of summarise the evidence and help translate that into sort of understandable format in one place. But if you have any sort of other suggestions of topic areas that you'd be interested in, then we'd be really sort of interested to hear that. Because we've done quite a few in the past. We've done sort of obesity and ethnicity, mental health, obesity and alcohol. And they're sort of really quite sort of important topic areas that we can summarise the evidence on. So as well as looking at sort of the research evidence, we also produce sort of summary fact sheets on the key data that are available. And I think some of these have been put out at the back. I'm not sure if they've already been snapped up already, but there has been some printouts put at the back. But we produce what fact sheets on the key sort of national level data, mainly on diet, physical activity, on weight status, and looking at sort of socioeconomic status sort of among obesity data. Oh, thank you. Shireen, when we were sitting down there, said, don't forget to mention the paper we did with the LGA. I wrote it down and then completely forgot 5 seconds later. Yeah, so we have actually worked jointly with the LGA to produce briefings sort of directed specifically towards sort of local authority and our colleagues there. And so the most recent one we've done is on obesity and social care. So that's available through our website and through the LGA website as well. Thank you, Shireen. And this is sort of another significant piece of work, which is sort of a new piece of work. And about a year or so ago, we started investigating how we can provide excess weight indicator data for the public health outcomes framework at local authority level. So at the moment, the only local authority level prevalence we've got are from modelled estimates from 2006, 2008. So we sort of looked into options with the Department of Health to try and sort of decide how we can collect these data and sort of produce robust estimates of adult excess weight at local authority level. It was decided to include questions on height and weight in the active people survey. This is self-report height and weight, but what we've done is some analysis looking at the data and comparing it to measured data from the Health Survey for England, just to sort of see how robust the data are. And you can see sort of the green text on the screen sort of explains the systematic error, we've called it, in reporting. And it's kind of what you'd expect, which reassured us. Men overestimate in their reporting of their height, and that's generally across all ages. Women generally, compared to men certainly, more accurately report their height, but this is less so in the older ages. I think everyone in this room is always aware that generally height decreases with age. And so I think a lot of times people are reporting their height as they knew it, perhaps when they were sort of in their late years of adulthood. And unsurprisingly, I'm sure to everybody, women underreport their weight, and that's consistent across all ages. Men, compared to women, do more accurately report their weight, but they do vary. So we can see here that the reporting of height and weight does vary across ages and across sex groups. And because of that, we're able to make adjustments for these differences. So the data we're going to publish in February in the Public Health Outcomes Framework will be this adjusted prevalence of excess weight. We've managed to adjust it to be more accurate for what you'd expect if you did have measured data, and so we've done a lot of work looking at that. And so we'll publish more information on our website about our methods, so you'll be able to get that as well as the data from the Public Health Outcomes Framework. I'm going to now invite Hywell Dinsdale up to the stage, who produced this cost effectiveness tool, because he can talk a lot about it, and it's really good.
Don't worry, I won't talk too much about it. Don't worry about that for the moment. The idea of this tool was a lot of people out there were saying, you know, we're running this intervention and we're trying to put in for, or we want to run an intervention and put in for funding, or we've run this intervention and now we're being asked, like, you know, what were the benefits of this, like the economic benefits of this. And what we've built it's by no means a sort of like completely finished product that captures everything, but it was just to try and start putting some numbers on the benefit of like weight management programs. So the idea is to take a number of like really simple inputs, which I'll show you in a minute, and sort of stuff that either if you've run an intervention, and especially if you've followed something like the CEF for your evaluation, you would have access to this information. Or if you're planning an intervention, the sort of thing that you'd easily be able to sort of take sort of an educated guess at, like to say, well, roughly we think we'll have this amount of whatever. So quite sort of simple inputs, and you drop them in and give you quite simple outputs in terms of like an economics cost, which at the moment is just NHS healthcare savings. And it's got some other things like a breakdown by disease group, which I'll show you. So the idea is it's quite a simple sort of tool. It's perhaps not the most sort of friendly interface at the minute, but over time we'll hopefully improve that. But I don't know if you can see little blue boxes which you type into, and there's like one data input screen, which is essentially 10 inputs, which are basically the number of participants who've been through your intervention, percentage of dropouts if you want to factor that in, the time taken to recruit the participants, and this is just to enable us to sort of accurately spread any savings over time. So if your intervention's like going to run over 3 years and people are not all, it's unlikely everyone's going to start right on the first day. So spread that out. The whole tool works on sort of mean values, because we didn't want people to have to start to enter individual ages or you know, age and standard deviation, which we thought might be a bit taxing for people to get. So you've got to take a guess at the mean age, the mean starting BMI of your population, and the mean reduction in BMI. So what as a result of the weight reduction intervention, like how much is their BMI going to go down by? We also need to know, or at least have you enter or take a guess at, like the time taken to achieve the BMI reduction, how long that BMI reduction is going to sort of last for. And then we do need something on the cost of the intervention to make a sort of cost-benefit analysis, and if you want to factor in discounting, you can enter a discount rate. And then the tool gives you, like, hopefully quite a series of quite easy and simple outputs. There's like a simple output table, which you probably can't really read, but on the bottom line is just a cost-benefit ratio with and without discounting. You've got some red numbers, it's not broken even in the first year, it's not broken even by the 5th year, but by the 10th year, it's saving about 48% more than it's actually costing. And the other sort of chief outputs in there's a bigger set of output tables with loads of detailed outputs broken down by disease and single years. The model projects forward for 25 years from the start of the intervention. There's also a series of like graphical outputs. This one shows like the reduction in BMI. So your participants drop down by about, in this intervention, by about 5 BMI points, and then over a period of time go back up to where they would have been without the intervention. There's a series like of, this chart's a bit complicated, but the idea is it shows like the number of cases of diabetes with and without the intervention. The sort of thick blue line is like the cases without the intervention, and the light blue line is the number of cases, the dotted purple line is the number of cases of diabetes with the intervention. And then the green bars show like the number of, the dark green bars are the cases of diabetes prevented in that year, and the light green bars are the cumulative case years of diabetes, which is what we really add. That's how we're calculating the healthcare savings, because we know how much it costs to treat somebody with diabetes for 1 year, so we can kind of sum those up. And these sort of charts are provided for the 5 diseases within the model, which are diabetes, heart disease, stroke, colorectal cancer, and breast cancer. And then the tool provides like savings by disease group, like healthcare savings at the moment, and also like a sort of chart which shows like cost-effective, the cost-benefit calculation. So on here you can see the green bars in like healthcare savings. So for the first sort of 15 years or so of the programme, you're starting to get savings in healthcare costs. And then after 15 years, you're actually getting a slight increase in healthcare costs, but that's as a result of the individuals who've gone through the intervention staying alive for longer because they're not dying so quickly because they've not got such a high BMI. They're less likely to get the conditions which would lead to higher mortality. And the green bar on there shows the cumulative savings minus the cost. So that's really the sort of cost benefit line. And sort of crossover point around year 6, which means around year 6 is sort of breaking even and sort of saving money after that point. I think that's the last slide, but yeah. But at the minute, we've only built the tool. The idea was to get something where there's like an engine where people can input their data and get the sort of outputs they hopefully want. And at the minute, we only like incorporating NHS costs saved, basically, so healthcare savings. But we do hope to expand the model to include things like social care and savings as a result of like reduction in years of life lost and like increasing like kind of sort of quality of life and things like this. So the idea is to expand it in future to include sort of wider range of sort of savings and therefore capture like, you know, the wider benefits of like weight management interventions. So the tool's kind of in a stage where it can be shared. It's not launched yet. It's going to be launched in the early next year. But we are willing to share it with anyone who wants to have a play with it and sort of get sort of feedback. We've had an expert group with sort of users from local authorities, health economists, a variety of different people. But we are kind of always up for more feedback. So if anyone wants to have a play with it before it comes out, if you just come and have a word with me later and give me your email address, I'll send you a copy over. I think that's it.
And there will be a user guide as well that goes along with the tool that will help sort of explain the inputs and the outputs. And I think what Hal was mentioned before actually at previous workshops is it's not only useful for sort of inputting the data for the interventions that you are currently running or have run, it's actually really quite useful to sort of play with what you would have to do as part of an intervention to become cost effective. So you can sort of use it as a tool to sort of to see how much reduction in BMI that you'll need in the population for the intervention to be effective and cost effective. So I think it's going to be a really useful tool for people working in public health. So my final slide is, well, make contact with us. We want to hear from you. We want to be able to work with you and support you in your work. We have a weekly knowledge update that I imagine a few people in the room at least will be receiving on a weekly basis. And that's a summary of all of sort of the peer-reviewed sort of articles relevant to obesity that have been published that week, as well as other sort of guidance, publications and other reports that have been available. And you can join that by going onto our website and joining the mailing list for that. We're also on Twitter. I think a few people have tweeted already today about today's event, which is great to see. So please do follow us and sort of tweet at us and hopefully find the information that we're putting out useful as well. So I've got our email address down there and our website address. So just looking forward to working with you and receiving your feedback on our resources. Thank you.